Yay Media Group.
Brain health. There's so many different ways to look at this, so many different lenses that we are thinking of brain health and what's important to us. It's not just about preventing dementia years from now. It's also about how clearly we're thinking right now, today, how quickly we're reacting to things, our focus, our how calm, how anxious we're feeling. So, in this episode, we're exploring the science behind nutrition, supplements, and lifestyle habits that support both our immediate focus and our long term brain resilience. A quick note before we dive into today's podcast. If you like what you hear, I would love for you to subscribe to Fueled Wellness and Nutrition, wherever you download your podcast. It would also be incredible if you take a minute to rate and review this podcast. Those things do matter and they really help us. I'm Molly Kimball. Welcome to Fueled, a wellness and nutrition podcast. I'm a registered dietitian and nutrition journalist with a passion to help people live their strongest, healthiest life possible. In my weekly TV segments and columns, there's a limited amount of time and space to cover everything, but there's so much more to share. This podcast is my opportunity to dive deeper into the topics you want to know about. So today we'll be looking at things like nutritional approaches like the MIND diet, nutritional supplements, things like L-theanine found in green tea, things like curcumin, omega-3s, creatine, supplements that have been studied and looked at for how do they impact our memory, our brain's processing speed, our attention, things that are also looking at slowing biological aging and supporting that brain resilience over time. So today we're digging into all of this, how our lifestyle choices, our nutrition, our movement, our sleep, and especially how specific nutrients affect both short-term brain performance and our long-term brain protection. And to help us sort through the science and also the hype, I am joined by Dr. James Rini, a behavioral neurologist at Ochsner Health, whose research focuses on innovative approaches to detecting and treating neurodegenerative diseases. Dr. Rini received his medical degree and master's in public health from New York Medical College in 2015. He completed his neurology residency at the University of South Alabama in 2019 and a fellowship in behavioral neurology at UCSF's Memory and Aging Center in 2021. And since 2021, Dr. Rini has been on staff with us at Ochsner Health. So welcome, Dr. Rini. I am so excited to have you here with us today.
Thank you for having me.
So this is our first time, my first time meeting you. I've heard a lot about you. I've seen a lot of the work that you're doing with our patients, but also out in the community. So I'm grateful for you spending this time with us today.
Well, pleasure to be here.
As I was thinking about this, and I knew I wanted to do a podcast on brain health, but even the concept, how do we even narrow down that scope, that focus of brain health? Because as I was thinking, there's so many different interpretations that someone may have of it. It can be long-term prevention of things like dementia, Alzheimer's, protecting our cognition, our memory, but it can also be short-term, our ability to focus, how sharp we feel, our mood, our levels of anxiety. So all of those really kind of play into brain health. So I guess when you're getting that question out in the community, how do you sort of distill it down for a conversation like this?
So good question. And honestly, this is a question faced by the greater neurological community. There's been multiple initiatives, both on the state and federal level, to focus in on what is brain health and who owns it. There's always been that argument between the worlds of psychiatry and neurology, who owns those manifestations of the neurological or the psychiatric in terms of how it plays out as we get older. And honestly, that answer differs depending on what age group you're talking about. Someone who's in their 80s has significantly different priorities than someone who's in their 30s. And so when it comes to distilling, really, it's not a one answer for every population. We find often people who are in their 20s or 30s, they're dealing with the stress of getting into a new world whereby which they have to maximize their output. And these individuals are looking at things that can optimize function. They often sort of move towards those stimulant medications or repurposing of things like Adderall, Vyvanse, modafinil, or some of the new nootropics, which are, again, cognitive enhancers, quote unquote, or once you get into your 30s to 50s, these individuals are more often concerned about what they're seeing in their parents. They start talking about, okay, so now I'm not feeling quite as young as I used to be. I'm not feeling quite as fit. Maybe they start getting the diagnosis of hypertension or hyperlipidemia, and they see their parents sort of dealing with other medical conditions. They are, so I need to be more proactive now. From your 50s to 70s, those concerns sometimes actually go under for a little bit, and usually you just sort of get into the rhythm of things, and then they reemerge in your mid to late 60s and 70s when the symptoms actually begin to emerge. And now we're talking about, okay, something's actually here now, and I probably need to start intervening upon it. So honestly, sometimes it's like, brain health is how much can I maximize my output? How can I prevent things from declining in the distant future, an idea that's only a remote idea in my mind?
Right.
And how can I reduce my genetic risk factor? Should I even have one? And how do I investigate that concern versus, okay, I've got something wrong with me now, and what am I going to do about that? So again, it's a different, same question, but different answer depending on where in the life spectrum you find yourself.
So when we have the conversation about lifestyle modifications, when we look at nutritional, whether it's nutritional changes, supplements that we'll look at, habits, the regular things that we're nourishing our bodies with, there's the nutrition, there's movement, there's our sleep. These lifestyle modifications that we look at, there's the short-term benefit, the long-term benefit, and really the answer, like you said, it's individual. It's to the person, what stage they are in their life right then, and or what experiences they've had with people around them. I find just in my own experience and also just conversations with our clients, it seems like there's sometimes the fear of long-term conditions, chronic conditions that they're wanting to stave off, but what can motivate them for the here and now and the decisions and choices they're making today, or how they're going to feel right now. So I think also when there's the things that we're adding in that can help us today in this moment feel better, feel more alert, focused, on our A game as best possible, when those can also maybe also be a long-term benefit even better. But I think, so we'll kind of be speaking and maybe going back and forth of between these a little bit as we talk. When we talk about different modifications or lifestyle changes, there's, like we said, nutrition, there's movement, there's supplements. Starting with nutrition, is there just general food as you're looking at it? Are there certain parameters that you sort of say are kind of your overarching guidelines that you would say for brain health in general?
Well, most of our dietary recommendations for brain health come from derivatives of blue zones. Blue zones are areas in the world that, on average, live into their 80s, 90s, and 100 with low medical comorbidities. That means low heart disease, low cancer, and low dementia. We take these populations, we analyze them for their lifestyle characteristics and dietary habits, and we synthesize an idea of what probably we need as humans. Because unfortunately, when it comes to something as complex as longevity, there is no magic pill, there's no singular supplement or mineral that we all need to necessarily maintain our brain health. So we understand it's an aggregation of these different components, and no randomized controlled trial has been able to do that quite yet. So we learn from what we've already seen in the world, and for the most part, the diets started out with the Mediterranean diet when we started analyzing individuals back in the 70s and 80s and realizing that individuals were doing much better in the Aegean Sea and Sardinia. We created things like the Mediterranean diet, which was basically a short form derivative of the dietary habits of that region. But over the last, 30 to 40 years of research, we've seen that these types of diets can be modified, and you see them in Okinawa and certain parts of South America and Loma Linda. And when you pull them all together, we realize, okay, so it's not necessarily a strict Mediterranean diet, which is necessary. The Mediterranean diet was derived and found to be helpful for cardiovascular issues. We modified it a little bit, took out a little bit of salt, added more leafy greens. We created the DASH diet, which focuses on blood pressure and liver health. We modified that a few more times. We created things called the MIND diet. And the MIND diet is, at this time, probably the best body of evidence we have for maintaining brain health as we get older. It's basically the Mediterranean diet with a few more key characteristics. Again, low processed foods, increase in omega-3s. That means things like fatty fish, fatty fruit, fatty nuts. Things like salmon, tuna, anchovy, sardines, avocados, coconuts. All these foods have a high concentration of omega-3s, EPA, and DHA, things that we know are helpful for maintaining brain health, not just as a form of nutrition, but also to help rebuild and maintain neuronal membranes. The other part of the diet is a diet rich in flavonoids. These are natural anti-inflammatory particles, things like blackberries, blueberries, red cabbage, high-potency cacao or dark chocolate. When done together in actual longitudinal trials, has been shown to significantly reduce not only the subjective and objective measures of cognitive decline, but also the functional deficits we associate with neurodegeneration. So if it comes to a single diet that I'd have to recommend, it would be the MIND diet. But the truth is those who are most likely to integrate this into their world are individuals who've had a certain habit their entire lives. And usually that's very difficult to actually sort of change on a dime to fit what the doctor's recommending in terms of what you should do based upon so and so forth on the other side of the planet. So I try to really emphasize integrating healthy foods to maintain the adequate nutritional intake as opposed to necessarily removing quote unquote harmful foods.
So kind of to recap, the limiting the ultra processed foods, which we talk a lot about on this podcast, limiting our ultra processed foods, the sugars, added sugars, white starches, white refined carbohydrates, vegetables, plants, leafy greens, berries, fatty fish, fatty nuts, whole grains when you're having the grains. And so I think all of those things are, like you said, it's kind of that hybrid of Mediterranean diet and then DASH diet, which was developed for hypertension, so keeping sodium in check. And those are things that are just good for us to have anyway. When we're nourishing our body with these foods, the more that we're focusing on adding these in, it's also going to be edging out some of the other stuff. And so those are things that are going to leave us feeling good and are going to have other side benefits in addition to brain health. And so when we look at glucose control or reducing our risk of cardiovascular disease, inflammation, all of these things are going to tie in and benefit that. So this gives us even more reason to emphasize these types of foods in our diet. And just pulling some of so if you're looking for more on it, you can Google the MIND diet, MIND. And, studies looking at the MIND diet are looking at slower cognitive decline, reduced risk of things like dementia. So if you're looking at this and you're looking for more, just search MIND diet. It's as it sounds, MIND, MIND, and you'll see the details on it. You'll see kind of examples, sample plans that are focusing on these foods that Dr. Rennie's talking about. And again, it's just good, solid nutrition. And studies so far are looking at the MIND diet linked to slower cognitive decline, reduced risk of dementia. And again, all these other side benefits that you're going to get from just a good, solid, nutritious diet. And so if this gives you one more reason, I'll take it. Beyond what someone would say, okay, I know, the shoulds, there's always I know I should have more vegetables, fruits, berries, any of these things, cut back the sugars. Beyond that, what are some of the supplements? Because, so I also want to really, I always like to drive this home. Before you're looking at adding in any of these supplements, you first want to make sure you have that core foundation of your nutrition plan in place. There's no point in just eating, the opposite of what we just said, and then adding in all these kind of high end and potentially pricey supplements. So the idea of the supplement is when you're already doing a lot of the good stuff, what are some of the things to add in? So what are some of the things nutritionally that do have some research behind it that someone could say, you know what, if I'm adding this in, it could help me short-term and or long-term when we're talking about brain health?
Well, when it comes to supplements, you have to be very careful because, like you mentioned before, and I completely agree, let your food be your medicine. Most supplements really don't do much if you are already optimized. And that has been sort of been proven over the last 50 years plus. We've monitored the supplementation of different types of vitamins over about half a century, trying to figure out which ones make a difference when you take it, even when you don't have a deficiency. And generally to date, the only vitamin I think that has the strongest body of evidence to supplement, even if you don't have a deficiency, is vitamin D. And arguably the reasons none of us are in the sun anymore. We've known this for a very long time. It helps with your your bone health. It helps with your immune system. And we've shown that people who have severe deficiency often have a much higher risk of cognitive impairment and dementia as they get older. So again, it's we all should be taking probably some vitamin D3 or at least D at this point. Having said that, again, we always have to be careful about supplementing anything into excess. Too much vitamin D can cause kidney stones, hypercalcemia, as well as a host of other issues. So always defer to your physician regarding your individual needs based upon your other medical conditions. When it comes to other vitamins at minimum, now the B vitamins, B6, B9, and B12, do have evidence, but big caveat, most of the time is that as we get older, our capacity to absorb nutrition often diminishes. Sometimes it's pharmacologically related. Someone's taking a proton pump inhibitor, an acid reflux medication, and that's going to interfere with your capacity to break down foods into their composite parts and therefore absorb them. As a consequence, many water-soluble vitamins, B6, B9, B12, are at a high risk of having deficiencies. And I often see this in clinical practice. We get into our mid-60s, early 70s, and it's extremely common to have B12 deficiencies, which can cause neuropathy, myelopathy, or a demyelination of the spinal cord, or brain fog. So again, it's not that supplementing these things without a deficiency makes a huge difference, but definitely adding them for someone who does have a deficiency makes a huge difference.
If someone
So
has
that
a hard time absorbing or is not able to properly absorb something like B12, there's a sublingual that could be an option that goes under the tongue. Or would they explore something like infusions, B12 infusions with their provider?
Good question. So some people have a thing called pernicious anemia. They have inability to secrete the enzyme and the protein that binds to B12 and allows its absorption, in which case you have to just bypass the stomach and go under the tongue or use an intramuscular or subcutaneous injection. The subcutaneous is usually the easiest to get both over the counter, and most people are happy with that. 5,000 micrograms once per week is more than enough for most people. And again, if you treat the B12 deficiency, often people feel better, a little bit less brain fog, and you can at least decrease the risk of neuropathy and myelopathy.
One more question on
B9,
B12, because I get a lot of questions on B12. If someone is, there's a lot of, so if someone says they're supplementing with B12 or they're doing B12 injections, is there a drawback? Or is it something that if someone says, you know what, I'm in my 70s, I'm in my 80s, I'm thinking about my stepmom. And, if they're someone who, their friends are always talking about B12 injections, if they do this and maybe they're not deficient, but they're still doing it, is there a drawback? Or because of the fact that it's water soluble, is it pretty benign? And sort of one of the things that's like worth trying and there's not a harm.
Well, everything to excess can be harmful. And yes, it is water soluble. So for the most part, you'll urinate the majority of it out. But anything, again, to excess can cause harm.
Okay.
Generally, the injection, 1,000 micrograms once per month is not going to cause harm. It'll just keep you at a therapeutic point. But again, like always, you have to, big caveat, make sure, again, no other medical conditions that might play a role in the ability to absorb or use. But generally, it's fairly safe to supplement if it's the IM injection once per month, or sublingual once per week, or just oral once per day.
Okay, great. There you go, Pat. That's my stepmom. There you go. Sharing it, but that is I think that to some degree there may be also the placebo effect there, but feeling like they're doing something,
Oh yeah, but to that end, again, there's been increasing evidence to suggest that just the general supplementation with a multivitamin is helpful in the long run. And I want to stress, we've studied this from like 30-year-olds to 60-year-olds and monitored them over that period of time, and not really shown to decrease any specific disease other than vitamin D. I want to stress that. But there was a VitaCox trial that came out in 2010, and then a new study that came out just 2 or 3 years ago that looked at Centrum. And they were showing that just the general multivitamin supplementation did decrease the potential risk of brain atrophy over, I think it was a 12-month period. But I want to stress, again, it was likely they were replenishing a deficiency that was just part of having a Western diet, plus normal aging related malabsorption problems. So
There's
again, there might be a benefit that we should all be taking a little bit of a
right.
multivitamin, usually once we get past the age of 60, 65, just to supplement in the event that we do have a deficiency. But again, it's the supplementing, even when you don't have the deficiency, doesn't seem to have any clinical benefit.
When we're talking about, that short term or long term, and that short term of increased energy or focus or alertness, one of the things that, over the several decades of working with clients on this, it is when someone's taking their multivitamin close to bedtime, it can be hard for them to fall asleep. And the assumption being that's probably because of the B vitamins in there. And not everyone is sensitive to it, but a lot of people are. And so we'll usually say, if they take it in the morning, they may not have enough food on their stomach and they're feeling a little nauseous, queasy. But if they take it close to bedtime, they're laying in bed and they're just like kind of wide awake. So there's something in, and so a lot of times we'll say, take it midday, take it with lunch, and then you get food and it's far enough from bedtime. But for some people, there is something in there that's giving them that level of alertness. And so the way that I also look at it, and completely anecdotally, but if they're taking it at lunchtime and there is something there, a lot of people kind of have that natural lull in the afternoon. So, it's either placebo effect or there might be that little bit of extra bit of alertness that it's giving them to kind of get over that hump. But for some people, taking it at nighttime can keep them wide awake. So there may be something in there that they're not getting in their normal diet that when they're taking that multi. So I always look at a multi as just kind of insurance, very low risk, low cost. And so for most people, I would say, why not, as something just as a general to add in.
I'd agree. A good way to frame it is insurance.
Yeah. Tell me about creatine. This is one that's getting a lot of conversation lately.
So creatine. So we've known about creatine for over 100 years now. It's one of the primary ways that we store energy in our muscles. And over the last 30 years plus now, we've been able to create it, phosphorylated or creatine, which is as a supplement for bodybuilders, muscle health. And it has a very solid body of evidence in terms of helping, again, bulk up an individual during a rigorous exercise, or at least improve the time for recovery. No argument regarding that. Now, what isn't instilled in debate is its clinical utility for brain health. Now, we know creatine is also used in your neurons to help maintain long-term both potentiation but firing during stressful states. And there's been a renewed interest in it recently as a supplement for long-term brain health. The data is mixed. There's really no good long-term trials in terms of saying supplementing this in your 30s will help you in 80 years later, or when you're 80. In terms of short-term benefits, even that's a little bit inconclusive. There's been a few studies here and there that suggest that it might help improve working memory deficits in individuals who already have some mild cognitive impairment. But where I'd say the evidence is most strong is in individuals who are already sleep deprived, which means they're already working at a deficit. Creatine does help the recovery period and then improve, again, working memory, attention, and concentration after supplementation. So I would say that the long-term evidence will probably one day point in the direction that the same thing we saw in muscle recovery is that if you have a deficiency and you supplement an energy, then the muscle or neuron is able to fire more effectively. That logic follows what we've seen in the body for 30 years of research, and we're beginning to see that now in the nervous system. So I'd say right now at low doses, it's very safe, 3 to 5 milligrams. I would be careful, however, because there's been a lot of talking heads on YouTube recently that have been recommending high doses, 20 grams per day for the supplementation of brain health. And you need to be careful at those doses because it can start to cause problems, kidney issues, if you've already got a proclivity towards that. But at low doses, this has been tested in humans for a very long time and does seem to be safe. And at minimum, if you're working at a deficit for whatever reason, just seem to improve the rebounding and recovery.
So a note on creatine, this is one of those that, when I first started out as a dietitian, late 90s, early 2000s, we thought of creatine as bodybuilders, football players. And I would have never thought that I would be saying that I take creatine and that my dad, who's 85, takes creatine. It's one of those things that as we learned more and more and as the science became clearer, we realized it's not about bodybuilding and mass and size. It's about that recovery. It's helping your muscles recover quicker, helping your body with that energy production quicker and more effectively. And we also see that in older people, 60 and older, have the a more significant benefit from supplementing, vegetarians, vegans, and people over 60, from supplementing with creatine from that muscle perspective. So as Dr. Rennie's saying, likely that could mirror the same thing for the brain benefits. There's what we used to say was a loading phase. It used to be thought that that was something you kind of had to do, that 20, 30 grams a day that Dr. Rennie's talking about. Instead, we just really simplify it, wipe that, and 5 grams a day would be essentially what's recommended. The last thing I'll say on creatine, there's the ingredient that has the gold standard, that has the most testing. It's what's used in studies, and it's called CreaPure. So you're not going to see a product called CreaPure on shelves, but you'll see the label that they say we use CreaPure as the ingredient in creatine. So I look at that as the brand that whenever I'm looking at what to purchase. You can do pills, but you have to take a lot. Usually if you're doing powder, it's just one little scoop, and you can put it in any type of a beverage. It just, it doesn't really dissolve well. You got to kind of slosh it around, but that 5 grams a day for women, for men, vegetarians, vegans. And then once you're starting to be, in your 50s, definitely over 60, again, always we kind of preface it with talk with your provider. And in some cases too, if you're looking at potential supplement or medication interactions, I always recommend talking with your pharmacist as well. And so, but that's something that we've been looking at for muscle gains. And so for brain gains too, I like that there's also the potential for that. Talk to me about omega-3 supplements. We talked about omegas in our diet. What's your recommendation as it comes to supplementing with EPA, DHA in that space?
Recommendation is let your food be your medicine. Generally, if you're getting your diet, it's cheaper, it's better for you. Most of the omega-3 supplements you're going to buy over the counter are processed from the parts of the animal or fish that could be sold at the marketplace, boiled down, denatured, and covered in plastic, and sold to you about 3 times the price. So I will say this: if you can't get fish, fatty foods like avocados or coconuts into your daily diet, or even just a tablespoon of cold pressed olive oil, then yeah, sure, omega-3 pill, that's okay. But again, I'm a big proponent of diet, if not just for the cost, but for all the variables that we don't yet understand, that we do associate with people who have rich diets in these types of foods, who too doesn't get benefit. Again, we're humans, and we're only so smart, and there's so many other variables that we have yet to elucidate. So I'd say, again, go back to the basics. We know food is good for you. We know good food is good for you. So again, I'd say if you're looking for a simple solution, a tablespoon of olive oil, cold pressed daily, is great. I get some in kale salad, which I have every single day. Some people don't like olive oil. You can, if you're a cappuccino person, you can mix a little coconut oil into your cappuccino, or even olive oil, which is actually quite tasty too. But again, if you can't get into your diet for whatever reason, then yeah, a high concentration omega-3 supplement with EPA and DHA omega-3s, it's been shown to be helpful for long-term cardiovascular health, which is helpful for brain health. One thing to be mindful of at high doses that can begin to act as a blood thinner. So for those who are currently on anticoagulants, Plavix, aspirin, Bixaben, etc., just make sure that your medical providers who are managing your medical conditions are aware of that, because again, that bleeding risk does slightly increase. More obvious side effects that people tend to be averse to, especially when you take the omega-3 supplement, is that nasty fishy aftertaste and upset stomach, which often then leads to people taking proton pump inhibitors and acid reflux, which then results in B12 deficiency and a need for an omega. So again, it's just, we're chasing our tail sometimes. So again, get in your diet, try to avoid the supplements wherever possible. If you can't, then I would support them.
So some of the brands that are tested for quality, purity: Carlson Labs, Nordic Naturals, and one that's a more affordable price point that's tested for purity and quality and true to label is the GNC triple strength fish oil. And one capsule of that gives you about 1,000 milligrams of EPA and DHA. There are vegan versions of EPA and DHA on the market as well, that are algae derived. So getting it through your diet first, if not, then going that supplement route. And I know we have just a few more minutes, and I think the last one that we'll touch on is one that's it's a little dicey, and I've just started to see this in the past few weeks even is lithium for brain health. And I've always known of lithium for bipolar disorder. And I also know that people who have bipolar disorder are often resistant to taking lithium because of the different side effects that they would feel of it. And that's been the very limited knowledge I've had of lithium. So to see that low dose lithium is being talked about for brain health, tell me a little bit about that and kind of the cautions or what to be aware of here.
So lithium, basically high up there on the low on there, the anatomic table. We've used it as a supplement for at least 100 years now. We used to put it in 7-Up because it helped calm down guinea pigs back at the turn of the last century. We took it out because we stopped doing that kind of thing. We've been still using it quite regularly for bipolar disorder because it is a mood stabilizer like we knew 100 years ago. The problem with its long-term use in the bipolar population is it can cause a number of issues, including kidney problems. And then from a neurologist perspective, tremors, which tend to not go away despite even removing the agent. Hypothyroidism can be caused by long-term use, rarely a goiter. Some people who already have pre-existing heart conditions can cause heart arrhythmias, but generally long-term concerns we are concerned about are, again, fine motor tremors, kidney dysfunction, thyroid, or heart issues. That said, the majority of people do not have those problems, but it's just always in the back of our mind. Now, the potential use for lithium as a medication to help cognition has been in and out of the literature for about 15 years plus now. There were some early studies in, I think, South America, Brazil, that were looking at its use in MCI, and they noticed that microdoses, again, much lower than the standard doses we use for psychiatric conditions. I think it was about 300 micrograms per day over about a year and a half. And it seemed to show a stability of some standardized cognitive assessments. Just for full clarity's sake, the tests they used were really basic things, what we call an MMSE, which tends to be stable over a year and a half anyway. And honestly, when you start talking about microdosing things like lithium, you're actually still talking about it as a mood stabilizer. So there's a good chance these early studies were simply showing that people who had stable moods scored better. So again, no direct causality there regarding cognition. Why this has sort of become more interesting for the general public in the last year or so was a paper in Nature that was looking at a new model of Alzheimer's using an organelle. And they were finding that that if you took out the Alzheimer's model outside of the rat, outside of the human, you just studied it on a petri dish, they were noticing that when you look at these amyloid plaques, they're noticing that lithium tends to get stuck inside them. And when it gets stuck inside these plaques, it causes a relative deficiency of lithium on the neuronal level. If you have a relative deficiency on the neuronal level, there is a failure to regulate a thing that what we call phosphorylates tau. Now, without going into too many details, Alzheimer's is the combination of first an amyloid plaque, which for all intensive purposes is a sticky form of scar tissue that is secreted in reaction to outside threats to the brain, viruses, bacteria, fungus, and tumors. It's perfectly normal. It's been in every animal's brain since the beginning of central nervous systems. The problem is that begins to build up to high levels due to either a failure to secrete or overproduction. It begins to cause local inflammation. That inflammation, if it causes enough injury to the regional neurons, can cause what's called tau. Tau is a protein that binds to and stabilizes the backbone of neurons to keep them flexible, dynamic, and help them branch out and create new connections. However, we've associated over the last 30 years is that Alzheimer's disease is associated with a hyperphosphorylation of this tau, which basically means the tau becomes unbound from that backbone, which it's trying to stabilize. And it's part of a cascading failure whereby which the neuron eventually begins to succumb to the local inflammation. We've tried to find new therapies to reduce that phosphorylation of tau, and it does appear that a deficiency of lithium leads to a hyperphosphorylation. So the argument the paper was making in Nature was that this regional depletion of lithium inside these plaques, inside the neurons due to a sequestering in the plaques themselves, was accelerating Alzheimer's. And by supplementing lithium, again, not in an animal, not in a human, but in this petri dish, they were able to reverse that hyperphosphorylation trend. So that's really promising, and it sort of fits into what we've already spoken about before, that if you have a deficiency and you treat the deficiency, you improve the deficiency. So there's a chance that in the long run, there might be a therapeutic benefit for potentially microdosing in individuals who have a deficiency, but we're really far away before we could actually say that there's any long-term benefit to this. There's been some epidemiological studies, very few and far apart, that have shown that in areas that don't have a deficiency versus those who do have a deficiency, people who don't have the deficiency have a slightly lower risk of Alzheimer's disease. But again, if there's a deficiency in the water of lithium, then there's probably other things going on as well. So again, these are associations, not causations. Promising research, and I look forward to seeing more. But it's going to be a while before we can definitely say that supplementing this can actually make a clinical difference when we're talking about 5, 10, 20 years of brain health.
Is this something that you're getting a lot of questions about from patients?
Oh, yeah.
Yeah. What are the risks that if someone did start with the low dose, like what, sort of like we said with B12, that might be a little bit more benign? I would think that lithium may not be quite the case, that there might be a lot of other considerations there. But what if someone did do low dose? What are the considerations?
Well, there it is. We don't know too much because we haven't had much longitudinal data for microdosing. We do know it's renally excreted and can be, you can interfere with it with a host of different medications, which a lot of people as we get older are on.
Yeah.
NSAID, ACE inhibitors, ARBs, diuretics particularly. And as we get older, creatinine clearance, or the ability to clear things through your kidney, is a little bit less functional. Elderly are often more sensitive to anything that might interfere with that. So it's not an easy answer, and there isn't a solid body of evidence to suggest that it is safe. I would say that the probabilities is pretty low, but I can't say that definitively it's ever been proven.
Right.
And when I hear individuals who are still in, let's say, their 40s, with a mother who, let's say, has the Alzheimer's in their 60s, and they're still, at the fertile age, and they want to start taking lithium, but then all of a sudden they get pregnant. We do know lithium does have a high rate of potential birth defects, so that's another concern. I would say, though, it's very likely at microdosing, probably safe, but as of this date, I don't have enough of a body of evidence to really justify its use, especially when it hasn't been proven to actually have any clinical benefit. I'd say there's a probability that even if we do have nice randomized controlled trials in the future, there's still that mood benefit that we see from lithium that might, confound any kind of signal we're trying to determine if there's an improvement in cognition. I think we need it's still going to be a way before we can actually definitively prove that this has a clinical benefit, but it is promising research, and I look forward to hearing more from it.
I appreciate you going down this path with me too, because I know it is one that's rearing its head often, and I know that we're almost out of time with you. So if you can, are there a couple of things that are actionable, things that today, right now, our listeners can start doing to support both that immediate focus, alertness, feeling on their A game, and also long-term brain health? So some of your big picture takeaways for folks.
Big picture takeaways: diet, sleep, exercise. I mean, this is how we live well as we get older. We all know if you don't get enough sleep, you're not going to be functional the next day. We see if you supplement something like creatine, you're feeling a little better, but you know what? You don't need the creatine if you got good sleep to begin with. Same thing with diet. If you're eating a balanced diet with good nutrition, you don't have any other medications that are interfering with your capacity to absorb. Well, you don't need the omega-3s. You don't need all the extra vitamin Bs because you've already got it in your diet. Exercise is one of those things that, again, we all don't move quite as much as we do. Honestly, though, the evidence is now sort of pushing towards that consistent, regular movement is actually far more beneficial than going to the gym for 2 to 3 hours per week and just busting your heart with a sweat. And, but we noticed from people who live in these blue zones, it's people who are just quietly moving all day long with isometric exercises and a little bit of cardiovascular, and they're not stopping to watch TV and eat too many foods so that they shouldn't be on the couch. Those are the ones that are doing better than the ones who are basically, just putting it all in again, 2 to 3 hours a week getting some cardiovascular exercise. I'm not going to say no to cardiovascular. That's helpful for everyone. But I'm saying we should all be quietly moving our body throughout the day. That's the best thing you can do. And I'd say biggest thing for those who are concerned about early health risks, again, we're in our 30s, 40s, and 50s. We're concerned about where we're going to be 30 years down the line. Educate yourself. Know your individual risk. Know your family history. Again, there's still a lot we don't know about the world in our own bodies, but we do know our families, and things tend to run in patterns. If you know your risks, you can change your lifestyle early, and that can make a huge difference as we get into our later years.
All really, really good information. I know that there's so much more we could cover, so hopefully at some point we'll have you back on and we can dive deeper into other topics. So I really appreciate your time, Dr. Rini.
Thank you for having me.